Hello guys, welcome back to Dr. Arshad Nadeem Awan Ultrasound and Radiology teaching videos. Hope you're all okay, you're all enjoying your life, you're also enjoying watching my videos, and you're also enjoying learning radiology, learning ultrasonography. As you all know that I have started the renal system, urogenital system, and with that series I will cover the entire possibly entire renal abnormalities, ureteric abnormalities, bladder abnormalities. So this will all be included in this series. Today, the topic which I have selected is a very common one, that is simple renal serous cyst. Every now and then you will come across cyst on the kidneys, and you might be confused how to label that case. So this is usually common renal serous cyst. It happens to be small, it happens to be large, it happens to be single, it happens to be multiple. So many variety you will come across with these serous cysts. If it is less than 3 centimeter, no need to worry for. But if it is more than 3 centimeter, just have a surveillance scan after 6 months to keep eye on whether it's enlarging or not. The only chance of rupture is associated with the enlarged cyst. So therefore, you have to have a follow-up scans after 6 months. And the second important thing is sometimes it may get infected. So therefore, you should keep eye on that. Otherwise, serous cyst is a very common entity, and on the ultrasound imaging, you will see it will be a thin wall, anechoic lesion, usually in the cortical part, and as I mentioned, maybe simple or maybe single or multiple, or maybe small or large. Whatever you came across, just mention the size on the report and mention and label it as a simple renal serous cyst. How it will appear on the CT images as well. So on the CT images, the CT density would be 0 to 20 Hounsfield. So how it will appear, so we are gonna see on these images. So let's start watching images for the simple renal serous cysts. This is transabdominal scan, and on this transabdominal scan you can appreciate well-defined kidney, and in the upper pole of the kidney you can see this is anechoic simple lesion, and this is simple cyst. Quite often we use the word simple renal cyst, but to be very specific, this should be used as a simple serous renal cyst. Just look within the lesion whether there is some contents or not. It is just simple cyst. Another example for the better understanding, just focus on this kidney, and this is the right kidney, and in the cortical portion you can see this is a simple cyst, and it's a well defined, it's a thin wall, there is no internal contents, there is no wall thickening, there is no wall calcification, and the best is you should put the Doppler effects on to confirm whether there is vascularity or not. So this is an example of the serous renal cyst. Again, another scan, another image for the understanding. You can appreciate the liver is there. This is transabdominal scan, and here you can see the right kidney, and in the right kidney one of the cysts which is slightly protruding out from the cortical portion because of its size. It has a bigger size and it is involving the lower pole of the right kidney. Again, it is simple cyst, purely simple cyst. There is no internal content, so you should have to label this as a simple serous renal cyst. It's a close-up of the renal cyst. Here these white arrows indicating simple cyst. This is simple renal cyst, and this is serous cyst. You can appreciate that the size has been taken for the kidney, so the same size should be taken in 2 dimensions for the renal cyst. Focus on the wall and focus inside the contents, and if there is nothing, so this is the best criteria fitting on the cyst as a serous renal cyst. As I mentioned earlier, that it could be small or large, it could be single or multiple. So again, this is an example for the multiple simple renal serous cysts. So it may be designed as such, like it may appear as such as well. So you have to take the history, whether the patient is having any kidney disease or not, or patient has been on dialysis or not. If these two symptoms are not there, so this would be a simple serous renal cysts. Another example for the multiple simple renal cysts, and you can appreciate that the sizes are different. In this kidney you can see the smaller sizes, you can also see the larger sizes. So this is what the simple serous renal cysts, and this could be multiple renal cysts as well, or multiple cystic kidneys disease as well. In this disease there will also be serous cysts, but they would be multiple. Sometimes incidental findings can be picked on the CT images as well, and this CT was not particularly performed for the renal cyst, but for some other reason. And here you can appreciate that this is a simple serous renal cyst, and it can be easily picked on the CT images. Look for the kidney, and it's on the right side, and this cyst is basically arising from the cortical part of the kidney. So this is how it will look on the CT images, serous renal cyst. So here is another example for the renal cyst, that is a serous type serous renal cyst, both non-contrast enhanced CTKUB and contrast enhanced CTKUB. The purpose of using the contrast is to look for the Bosniak grading. I have already uploaded a video for on the Bosniak grading. There is 4 types of the Bosniak gradings which categorize the cyst as a benign or malignant. So you should have to go for that and check that. So far this scan is concerned, on this image you can see this is a simple renal cyst. This is a serous type, and if you look for the CT density, this should be between 0 to 20 Hounsfield. Again on the axial and coronal images, again on the contrast and non-contrast imaging, to just make you understand that how the simple serous renal cyst will appear on the CT non-contrast and contrast enhanced images. It's quite easy to pick, you cannot miss that, but you have to pay attention if there is any contents within it, so that you can put the classification, Bosniak classifications on it. So this is simple serous renal cyst. Is a close-up view for the CT image, and here you can see that it has almost I would say occupied the renal parenchyma. I would not say rather obliterated, but it's occupying the majority of the cortical part of the left kidney. This happens to be a simple cyst, and there is no internal contents in it, because this was a contrast enhanced CT, and this was fall in Bosniak category 1 classification. As far as the renal scintigraphy is concerned, like for the renal, there are multiple imagings available, but this particularly not useful for, because the ultrasonography and the CT contrast and non-contrast imaging are the best modalities to pick the simple renal cyst or simple renal serous cysts. This is the video demonstration. Look at the renal cyst, how clearly it is visible on the ultrasound imaging. You cannot miss this. So look for the size, take the measurement in 2 dimension, and also clearly see that whether there is some internal contents in it or there is any wall thickening. But in that case there is no internal content, the wall is quite thin, and it is arising from the cortical part of the right kidney. So this how the cyst will look on the ultrasound imaging. So it's quite easy to pick. This is simple serous renal cyst.